And now to the Democratic Republic of Congo, DRC. The country confirmed on Tuesday the first case of coronavirus in the country. The patient first announced as a Belgian national, then as a Congolese living in Belgium, is being quarantined in the capital, Kinshasa. So what threat does this pose for a country that's battled epidemics such as Ebola? Over to you, Bridget.
Indeed, this case of coronavirus in the Congolese capital would be cause for concern. With an estimated population of 13.2 million people in 2018, Kinshasa is the third most populous city in Africa after Cairo and Lagos. But at the same time, the country could be sufficiently prepared to deal with it, according to the World Health Organization. The international body has appealed to the Congolese government to use the same efforts made in response to Ebola on the coronavirus. And since August 2018, DRC has been fighting the much more dangerous and deadly Ebola epidemic, which it is succeeding in curbing. After killing around 2,200 people, the disease has been dormant for 3 weeks. But how is the population experiencing this? We talked to our correspondent in Beni, Gaël Mpoyo, for more.
Correspondant d'Africanews à Beni, en RDC. Gaël, bonjour.
Hello, Gaël.
Bonjour à vous.
Alors, on vient de le dire,
as we have just said, Ebola is being defeated in DRC, and now the threat of coronavirus appears, with a case identified in Kinshasa and the rumor of a suspicious case in Beni.
Exactly.
The technical secretary of the multi-sector committee on Ebola virus disease, Dr. Jacques-Jean Muyembe, travels to Beni today to assess the situation of Ebola. This is after the last patient recovered. He'll take the opportunity to find out about a suspicious case of coronavirus reported to be in Beni. That is a French lady that was staying in this part of DRC. And according to Beni's chief health officer, Dr. Tosalisana, the suspect is already in isolation pending the results of the laboratory. And since the samples have already been sent to the National Institute of Biosafety and Biosecurity. So for now, there are no cases of coronavirus in Beni, according to the doctor, and therefore there's no need to worry. The population knows that the Ebola virus is already sufficiently informed about many other diseases. But in any sense, there's panic among leaders who are revealed to see the end of the Ebola epidemic.
Gaël, so what is the latest reaction from the authorities? What have they said about the Kinshasa coronavirus case, and what measures have been taken so far?
Well, Jerry, DRC authorities say that the patient affected by the coronavirus is relatively well. The health minister, Eteni Longodo, said on Wednesday that the 109 people who are in contact with him have already been identified. He appeals to the population not to panic and not to rely on speculation, but at the same time to continue applying good hygienic measures. To quote the word of Minister Eteni, the patient is doing more or less well, apart from the fact that he has the virus. For example, last night he did not show any signs of fever. He added that they are doing much more than simply follow the people with whom he had been in contact. So far, we know that 109 people will be placed in isolation. There are also the passengers who were with him on the plane on the 8th of March when he arrived in Kinshasa. The Minister of Health affirms that he is working with the immigration services and already has a list of passengers who need to be placed in voluntary isolation at home.
Avec le service d'immigration et possède déjà une liste de passagers qui doivent être mis en isolement volontaire chez eux à la maison.
So many internet users criticize the minister and the management of the Kinshasa case, and there's both fake and reliable news in equal measure. For some, the patient is a Belgian national, while others say that it's a Congolese.
Well, in
DRC, internet users, including some opposition members, believe that the case was invented in order for the minister to benefit from the funds allocated to the fight against the coronavirus. That he was wrong about the nationality of the person's illness is proof to them. By 2019, $4 million had been embezzled in the fight against Ebola, reportedly by the former minister. He has now been being prosecuted and is even banned from leaving the country. The said patient from Kinshasa, when interviewed by journalist Israel Mutombo, mentioned that he had a fever due to the vaccine that had been administered to him when in Belgium. The minister, for his part, confirmed that his department had detected the virus in his body, and when asked about the COVID-19 rumor circulating on social media, the statement read in part, based on what he said, he does not have the virus. There are people who write anything on social media. And the gentleman seemed only to understand it yesterday when he was told that he was contaminated. And when asked where exactly the patient is, Eteni Longodo maintains that he cannot reveal the place so as not to disturb the patient's tranquility, and he could only say that he is isolated and not in contact with the population.
A-t-il donc conclu?